Hello, Chase Heilman, Community Outreach Coordinator with Rural Health Incorporated here with a video about World Hand Hygiene Day. So what is this day all about? Well, let's take a look. Celebrated every May 5th, World Hand Hygiene Day mobilizes people to increase adherence to hand hygiene in healthcare facilities, protecting healthcare workers and patients from infections. Let's talk about germs and what they can do. Germs can enter the body through the eyes, nose, and mouth and make us sick. Germs that can make us sick can come from unwashed hands and transfer to other objects at healthcare facilities like handrails, countertops, and more. All of this can lead to various ordeals that aren't so fun, like diarrhea, skin and eye infections, and more. According to the World Health Organization, appropriate hand hygiene prevents up to 50% of avoidable infections acquired during healthcare delivery, including those affecting the health workforce. Here's a big one for current times. Appropriate hand hygiene reduces the risk of the virus that causes COVID-19 infection among health workers. Investing in hand hygiene yields huge returns. Implementation of hand hygiene policies can generate economic savings averaging 16 times the cost of their implementation. Scientific evidence demonstrates that proper hand hygiene is the single most practical action one can take to decrease the spread of harmful germs. So you may be asking yourself, what is the proper way to wash your hands? Well, according to the World Health Organization, you start by wetting your hands with water. Then you apply enough soap to cover all hand surfaces. You then rub hands palm to palm. Right palm over left dorsum with interlaced fingers and vice versa. Moving on to palm with fingers interlaced. Backs of fingers to opposing palms with fingers interlocked. Then rotational rubbing of left thumb clasped in right palm and vice versa. Rotational rubbing backwards and forwards with clasped fingers of right hand and left palm and vice versa. You then rinse your hands with water. Dry hands thoroughly with a single-use towel. You then use that towel to turn off the faucet. And voila! Your hands are now safe and clean. Washing hands with soap and water is the best way to get rid of germs in most situations. If soap and water are not readily available, you can use an alcohol-based hand sanitizer that contains at least 60% alcohol. You can tell if the sanitizer contains at least 60% by looking at the product label. But always remember, you must wash your hands when they are visibly soiled. According to the World Health Organization, your top 5 moments for hand hygiene include before touching a patient, before cleaning procedures, after the risk or exposure of body fluid, after touching a patient, and after touching patient surroundings. In conclusion, it's important we all do our best to practice good hand hygiene, not just today, but every day. Think of it this way. Is the health of your patients, including yourself, worth 30 to 60 seconds of your time? Just like the slogan for this year's campaign says, seconds save lives. Clean your hands. Happy World Hand Hygiene Day.